Hello, this is Dr. Do again. This video continuously from previous video, a systemic approach of medicine. Basically, the arrangement or the layout of this series of video is started from different structure, from inorganic compounds which are invisible, and to the cells and also the organelles and the diseases associated with these structures, and then move on to the 4 types of major tissues which are invisible, and also diseases associated with those tissues, and then move on to the organ system levels. So I talk about the diseases associated with intergarmentary skin and also skeletal, musculoskeletal structures, like for example the arthritis, and then I talk about the respiratory system associated diseases, and then move on to the circulatory system, which is the cardiovascular system associated diseases, and which introduction of the structure of the circulation, the structure of the heart, and also I talk about some symptoms or presentations. For example, I talk about the chest pain caused by the respiratory system or diseases, or caused by the circulatory system diseases, like by the heart or by the cardiovascular system diseases. And I finished the previous video by talking about the difficulty breathing, dyspnea, because when I talk about the respiratory system, I talk about dyspnea caused by the lung diseases and or respiratory system diseases. And I mentioned difficulty breathing can also be caused by the heart. Usually, if you imagine, if you know the function, integrated function as a whole body organism, and then you know that the heart provide the blood to supply the tissue to provide oxygen. So having said that, any diseases which can cut off the supply, either from the blood, which are responsible for transport the oxygen, or from the heart, which is responsible for provide or pump the oxygen to the tissue, any organs in this system, in this associated mechanism, will cause indirectly shortness of breath or difficulty breathing or gasping for air because of this hypoxia. So having said that, what kind of conditions from the heart or from circulatory system can cause this dyspnea, or from the heart, cardiovascular system diseases associated with dyspnea? I talk about the first one of the most common cause is the congestive heart failure. So this congestive heart failure, because the heart cannot function well, or lost the efficiency of the contraction, then cause the fluid back up to the lung. In terms of the mechanism, it's very probably not that complicated if you know it. But if you're interested, you can search it. Just basically, there's a remnant volume in the heart, and then the pressure starts building up in the chambers of the ventricles, and then back to the atrium, and then so that's why the fluid from the lung, or the blood from the lung, cannot overcome the pressure from the atrium. So basically, then the fluid accumulates in the lung, the pulmonary edema, in the other word. So this pulmonary edema caused by the congestive heart failure. This is the indirect cause of the dyspnea from the cardiovascular system. So what are the risk factors for this congestive heart failure? Could it be really just by the heart itself, or could it be by the other system disease? For example, the kidney disease also can cause this congestive heart failure, or the liver disease can cause the right side heart failure, which is not the cause of pulmonary edema. However, the right side heart failure may trigger the left side heart failure, which causes pulmonary edema. So this is kind of truly the medical mechanism. But just to let you know that the end stage of kidney disease or end stage of liver disease can also cause this left side congestive heart failure, and also pulmonary edema, difficulty breathing. That's probably not just like the heart itself. The disease from the heart post myocardial infarction, and also the arrhythmia, and also the cardiomyopathy. All of these conditions can lead into the heart failure and then cause this difficulty breathing. Another associated conditions with can cause difficulty breathing associated with the cardiovascular system is like the hypertension cause the congestive heart failure. It's included in that category, the risk factors. So wrapping it up, this is the difficulty breathing or dyspnea caused by the heart diseases with really the risk factors like hypertension, coronary artery diseases, and also myocardial infarction and arrhythmia, and other chronic organ diseases like the kidney disease and the liver diseases. So these are the indirect or direct cause of the heart failure and indirect cause for the dyspnea. So this is about one cause I can think about it. And of course the cardiomyopathy also another reason can cause congestive heart failure. And in terms of the other cause of the dyspnea from the heart, probably that's just in the severe situation, the fluid, a tamponade of the pericardium, that's also, it's just the fluid in between this pericardium and then limited heart normal contraction or dilation that can also cause the fluid backup or just the choking and the condition of the lung, difficulty breathing. And in terms of the presentation caused by the congestive heart failure, caused dyspnea, usually I mentioned before, is nocturnal, which means when you lie down, sleep during a flat, so the fluid back up to the lung really cause difficulty breathing, and usually those patients has to half sitting, half lying down for sleep, elevated pillows, or any kind of during night wake up, and also that's the symptoms presentation of this dyspnea caused by the heart failure. In terms of management, I think this is emergency. Usually it's chronic. It's not like could be acute, but usually it's chronic, particularly for those who had long-term hypertension. So you need to really see the physician, see the emergency room as soon as possible, provide oxygen to get rid of those fluid, and also to decrease the anxiety in terms of treatment. This is how to treat that. That's the medical physician's duty, but I've just mentioned briefly here. And also, so this is about dyspnea caused by the heart conditions, which are quite obvious, but in general, anyway, the heart, whatever the diseases that can cause heart failure, will have the risk factors for this. All the risk factors for heart failure will have this indirect cause of dyspnea or difficulty breathing. So I'm going to stop here. It's kind of not very well organized. Probably here they're confused, but just the taking home message is any risk factors for the heart failure will have the possibility of causing dyspnea indirectly from the heart disease. I'm going to stop here, and thank you for watching. I'll see you next time.